people that can't necessarily or are considering coming to see you, but they have their own surgeon that they like and want to use and local, blah, blah, blah. What questions should they be asking their surgeon that their surgeon doesn't think is important and is critical?
Yeah, I think the questions I get pinged about the most are capsulectomy questions. Like, should the capsule come out? And I've done, unfortunately, a number of cases where somebody's had their implants removed, but not the capsule.
Yeah.
So then they've remained symptomatic. And from our discussion, I think you'd understand why.
Yeah, so I actually want to go back. So basically, your rule is if you're getting implants out, it's definitely capsulectomy, no questions asked?
Yeah, with me, I always take capsule.
Okay. And that assumption is because if there's bacteria biofilm in there, you're just recreating the same scenario. You did nothing different.
You're not affecting the change, right?
Yeah.
So if we go back to like, and I've illustrated it, it would be like taking those little, stickies and putting on the implant and your scar tissue. And then when you take the implant out, you're still
got the sticky,
leaving that inside the pocket.
Okay, that came up with two more questions. So once someone gets their capsule removed and their implant removed, can they immediately, they're getting fat transfer at the same time?
Yeah, I do in select situations now. And we were talking about a little bit before we started is, toxicity is difficult and toxins can be stored in fat.
Yep.
So we try to aggressively evaluate upfront, and whether it's because it usually takes a few months, obviously, to get your logistics together if you're going to travel here, if you're out of Texas, and sometimes if you're in Texas.
But at least it's Austin. What a cool place to come hang out and get your surgery done.
And we have people here about a week, and so I'll explain that why. I'll explain why. I feel like people rush, once they figure something out. They're like, this may have been dogging them for a long time. And then finally someone like you says, maybe it's your implants, right? It has to be somebody problem aware to tell them and help them become problem aware, or they find out. And so once they do it, they're like, holy shit, I've wasted all this time, effort, resources. I've, this has affected every relationship I have. I want to get this done now. And then it's like this, you hit the button and it's got to be done in the next, 2 weeks. That's really never going to work in my ecosystem because the amount of people that would explant remain symptomatic would be very high.
Mm-hmm.
And it goes to what we've been talking about. People who have a lot of limitations in genetics, people who have really high tox burdens are not going to magically get better, barring those exceptions where they're infected, or maybe it's degrading the shell, it's ruptured. There's something that's really above and beyond. But in those patients who aren't, who are just exhibiting, like we were discussing, almost like a organ rejection picture, they're going to remain maybe a lot like that for a period of time.
Mm-hmm.
So we try to identify as much as we can, like what is really bothering them and help them better understand their genetics. I mean, I can listen just like you can listen to somebody and, oh, that person doesn't methylate well. Or, oh, obviously, if you have this horrible fatigue, like do you have mold or do you have a antioxidant pathway problem?
Dr. Whitfield, I think the root of that problem is you listened, right? Like how many other surgeons listen? I mean, I can even say family doctors. How many family doctors actually listen to their patients? So what's unfortunate is, like you said, like, oh, I might recommend an explant to someone. But unfortunately, this is a patient-led movement. Yeah. Patients are finding you on YouTube, finding out on their own that this is possible. BII, breast implant illness, is an actual thing, and they're seeking it out. This is not a doctor-led movement. Functional medicine in general is not a doctor-led movement. Hence why we're doing this podcast and shouting it from the rooftops that, hey, if your doctor isn't listening, go educate yourself. Go seek out, look for someone else.
I don't want to throw anybody
educate
under the
yourself.
bus here who's famous, who didn't want to have me on their show because they didn't think it was an important problem.
Ooh. Are we not allowed to? Now you have to tell me after.
I won't do it. But just in general, if you have a friend, a girlfriend, a spouse, aunt, mother, you have to like consider it.
At least ask the question.
Yeah, and I just remain curious. I think genetics are fascinating, and the reason we want to publish the paper is to compare our patient's limited genetic detoxification capability to someone like Dr. Topol published a paper about the elderly, these folks who lived into their 70s, 80s, and 90s without end-stage disease like Alzheimer's or a pulmonary condition or advanced cardiac disease. And people are like, well, why does that happen? Well, obviously they detoxify probably at a better clip.
Right.
There's no special longevity chain, despite
No one's
everybody's
talking about that. I'm surprised.
search for that. But I feel very comfortable in that I know exactly what our genetic archetype is.
Yeah.
I would love to compare it to somebody's study, and we got access recently to the data. It's just, as you would imagine, it's a lot of data to look at, and we're just looking at and comparing women to this other set.
So you're trying to find women women who have implants, kind of same age group
Our
type
group,
thing.
yeah.
And no, your group's the sick group, right?
Yeah.
So now you're trying to find a healthy group with
Right.
implants to
Without.
compare the genetics.
Without.
Oh, okay.
So we will not know if they had or did not have implants. But if you took a group that lived to 60, 70, 80, 90 without any of those end-stage inflammatory processes, that to me just, my hypothesis, they detox well. In addition to probably eating well, drinking well, having community, doing all the things that would...
Those just make you well-er.
Those wouldn't be needed, but they're not the necessary and sufficient things to start that way.
Right.
You would
Because
have
there's always going to be a Willie Nelson that drinks whiskey and smokes cigarettes and pot and still lives to 90 somehow and is still fine.
But I'm just super, and maybe I'll be shown wrong, but I have a strong feeling that those folks detoxify well.
Yeah.